If you're a fan of medical TV shows like Grey's Anatomy, you may have seen an episode in which a patient arrives to the hospital after suffering a severe car accident. They're bleeding out internally from multiple injuries, and the doctors have to race against the clock to save their life, because the more time passes, the more blood the patient loses, and the less chance of a recovery this patient has. These episodes are modeled after trauma centers, which are specialized to handle these complicated, time-sensitive injuries in which patients are bleeding out. And it's the job of the paramedic to decide if somebody at the scene of an accident meets criteria to be taken to a trauma center, or if they're not as injured and can be taken to an acute care facility, otherwise known as a general emergency room, that is not always equipped to handle time-sensitive injuries. Now, in Broward and Palm Beach County, 1 in every 3 patients that have an injury to an organ in their abdominal cavity accidentally end up in an acute care facility, where they wait for hours, bleeding out, before they are taken and transferred to a trauma center, where they finally are able to get the care and the management that they need. Now, I wanted to know in my research if the delay in receiving care that these transfer patients experience was associated with worse outcomes, because in trauma, the longer you wait, the more you bleed, and the less chance of a recovery you have. Specifically, we looked at spleen injuries because it is the #1 most commonly injured organ in trauma, and it is super fragile and it loves to bleed. So we looked at all spleen injury patients, 268 of them, and we analyzed to see if half of those, which were trauma transfer patients, compared to those who were directly admitted, if they suffered worse outcomes. And what we found was that even though overall the patients who were transferred had less injuries to other areas of the body, they happened to have exactly the same degree of severity of spleen injury compared to those who were directly admitted. And then those who were operatively managed, as you can see by my image above, they had to wait a total of 24.6 hours before going into the operating room where they had their spleen removed, while those who were directly admitted only had to wait 6.4 hours before having their spleens removed. And overall, the only differences between the transfers and the non-transfers were that the transfers stayed in the hospital less, but they had the same exact mortality rates, the same exact complication rates, and the same degree of severity of spleen injury compared to those who were directly admitted. Wouldn't you have expected worse outcomes? But that's where the delay in the transfer lies. The delay in the transfer caused these patients to have this exact same outcomes as those who were directly admitted. And if we can reduce the amount of time that the patient spends in the acute care facility, we can shorten the delay, and we hypothesize that these patients would have better outcomes.